Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, my dear listener, and welcome again. This week is the anniversary of 2 years of podcasting and faithfully launching an episode almost every weekend. I think I had 2 exceptions in 2 years. My episode is launching either Friday, occasionally on Saturday or Sunday. And this is all for you. And I want to thank you for your time and the dedication and the gift you have given me, the gift of your time and allowing me to be in your ear, listening to what I have to say, hopefully taking into consideration all the facts that I'm presenting, which are common sense facts about health, hormones, and anti-aging in general. And most of all, I thank you for allowing me to share my opinion regarding some of the health issues I tackle. So whenever you have to make health choices for yourself, you are going to make these choices from a more informed and maybe a different perspective from what you have known or believed to be the truth. So this week, I decided to go ahead and celebrate this anniversary of 2 years of podcasting by discussing a very important matter for your health and for everyone's health, a subject that is not being given much thought or consideration by the majority of medical professionals. And when consideration is being given, there's no clear agreement as to what is the ideal we should strive for. But this is also a topic that patients are more and more fascinated by, and they have questions around it. So what is this topic? Well, this topic and today's subject, and as well as for the next future, a couple more episodes, is going to be hormone levels and hormone testing. And I believe, regardless of your age, you want to listen to this episode. Now, I am going to reveal to you that this topic of hormone levels is a topic that's very dear and close to my heart, mostly because it is completely ignored by a lot of doctors who, by the way, sometimes prescribe hormones, not all the doctors, mind you, but some and pretty much a lot of them, and they don't even follow levels. And also because it is a very gray area with no black or white. You would think, wait a minute, there should be black or white. It's either good or not good. Well, this area of hormone therapy practice is subject to a lot of personal interpretation and very little standardization. This is why hormone management is always considered, and it will still be considered, an art. Maybe the reason for lack of standardization is because hormones are unique in how they react when they're introduced in the form of therapy into a woman or a man's body. What do I mean by that? Well, we know very clearly what estrogen does. We know very clearly what testosterone and progesterone do in a woman's body. But we do not know and we cannot anticipate how the introduction of estrogen, testosterone, or progesterone is going to impact a specific individual. We do know that in general, and for the great majority of women, for example, estrogen interacts with the female body in a very peculiar certain way, creating certain consequences and effects, just as the testosterone does in the male body. What we do not know is why some women love estrogen and some don't. We do not know and we cannot explain why estrogen is so amazingly beneficial for the great majority of women, but in some women, it has considerable negative consequences. Those negative consequences related to the way the body is processing the estrogen. Can we tell beforehand if we're going to have a problem by maybe looking at the hormone levels? Can we predict, based on a woman's hormone levels, if she's going to experience side effects or negative consequences if the hormone levels fall outside of an ideal range. And what would that ideal range be? What are we looking for? Let me ask you a series of questions, which I will aim to answer in this series of podcast episodes that's focused around the topic of hormone levels. But please take a minute or two to listen to all the questions, because these are the questions that I will address. When you do have your hormone levels tested, specifically by doing the blood level testing, do you want to know if they're normal or if they are optimal? Are you even aware of the difference between normal or optimal? Or am I just simply introducing a new concept for you? Maybe in your mind, normal and optimal are equal. They're not. Where is the difference? And why is there a difference? Why are they not the same? And what do these terms mean? Then what are normal blood levels for estrogen in a woman? What are normal progesterone levels for a woman? And what are normal testosterone levels for a woman? Does it matter what the age of a woman is when we're taking into consideration her estrogen levels? Meaning, does an estrogen of an 18 to 28-year-old, is it different than a 28-year-old or a 38-year-old or a 48-year-old? Now, is it true that a woman's estrogen varies throughout her cycle and throughout her lifetime? Yes, there is. That is true. And if that's the case, how do we know what is normal for a specific individual woman? Is the estrogen level in her 20s the same as her estrogen has been or will be in her 30s or 40s or 50s? The answer is no. And do you know why? Now, what is a normal level for progesterone? What is a normal estrogen-progesterone balance? What kind of ratio are we looking for? Everybody's talking about estrogen dominance and estrogen being too much and progesterone not being enough. Well, what kind of ratio are we looking at? What is a normal progesterone level in the first 12 weeks that is necessary to maintain the pregnancy until the placenta takes over? Do we have a level? And if we do have a level that we know it's important, why is not every single OBGYN testing for progesterone levels as soon as a woman walks into their door pregnant in the first trimester? Now, hopefully, after listening to my podcast for a while, you know that testosterone is a very valuable hormone for women. So what should a normal testosterone versus an optimal testosterone level be in a woman? Now, in this podcast episode series, I aim to address and discuss all these issues and answer all these questions. If you have ever asked yourself or your doctor these questions and really have not received or found an answer by asking Dr. Google or your doctor, then please keep listening. I will try to provide some answers for all of these questions with this mini-series starting this week. This podcast episode series is also addressed to all the women out there who feel terrible, all the women whose inner wisdom tells them they have a hormonal imbalance. However, when they ask their doctor to check their hormones and wait excited for the appointment, when everything shall be revealed and the results shall be discussed, to be told that their hormones are normal and what they feel is not a hormone imbalance or a hormone problem. This episode series is for all the women out there who have left the physician's office frustrated, disappointed, and without an answer to their problem when their hormones were tested. Keep in mind, you as a human being are much more than a sum of all your hormone levels at a given moment in time, but your hormones matter. They matter a great deal, and don't let anyone else tell you any different. Because if they do tell you different, they are simply speaking out of ignorance when they tell you your hormones don't matter and what you feel is not your hormones. And this is specifically important because as a patient, when you show up to a physician's office, which could be a primary care doctor, your OBGYN doctor, your internal medicine doctor, regardless of what specialty this doctor is, when you ask for your hormones to be tested, you need to understand that the doctor that you are making this request of should have at least some basic training and knowledge in hormone management and hormone medicine and hormone therapy. Now, here's the thing. Your doctor will be happy to oblige and will test your hormone levels most of the time. Some doctors just plain say, you know what, this is not my cup of tea. I'm not familiar with this. Ask your OBGYN or go see an endocrinologist. But most doctors who are agreeing to test your hormone levels will look at your test results And as long as they are matching the range of what is provided by the lab, they will simply tell you that your hormones look normal, that they look good. They will also tell you there's nothing wrong with your hormones. They might tell you or give you the impression that this is where your hormonal testing should stop, and there's no need for you to worry about hormones any longer. But here comes the Wellness Optimizing Warrior MD podcast, teaching you what you need to know, because you need to have an understanding of all the key factors that are involved in testing hormones. And let me give you just a few examples. For example, you should know that the timing of when the hormone is tested, especially where your sex hormones are concerned, could be a key factor in determining the interpretation of the results. And this is not just for sex hormones. I'm going to use an example because this mini-series is not about all hormones. It will take me a long mini-series to address all of that. It's mainly about sex hormones. I would like to use a few examples that have nothing to do with sex hormones to illustrate how important it is and how each hormone is extremely unique in how it's being released in the body. So let me use a few examples to illustrate the importance of this aspect of testing hormones, like the timing. Let's take your stress hormone, cortisol. It's being released by your adrenal glands starting very early morning, usually with sunrise. Your body will need to experience this surge in cortisol levels in order to be able to waken up, get up from the previous night's sleep, and function well throughout the entire day. Your cortisol levels will decline gradually throughout the day until they're very low in the evening, which allows you to relax, rest, and be able to fall asleep again. This understanding of what we call a cortisol diurnal rhythm is necessary for your doctor to order the right test and interpret it appropriately. We can test cortisol first thing in the morning to see what is the highest level of cortisol you start with. We can test your cortisol as a 24-hour urine collection that measures your cortisol throughout the entire day. Or we can test your cortisol by collecting saliva samples, usually 4 times a day, throughout the day, and plot that diurnal cortisol response as a curve, starting with the first sample in the morning, then testing gradually throughout the day, mid-morning, post-lunch, and evening. We can also collect urine and analyze cortisol metabolites that will give us an indication of possible abnormal pathways that most likely are genetically predetermined but could majorly impact your health. And this is just one hormone, guys. I chose to illustrate why timing of testing for a hormone matters, and I used cortisol. Even though checking cortisol levels and interpreting it, it's not really included in the barrage of questions I asked in this episode's introduction. But technically, every single hormone we make is subject to being released in a very specific way by the body. And interpreting levels for every hormone testing needs to be done in the context that matches the specific characteristic of that hormone. The same for insulin. Insulin baseline levels are best checked in the morning fasting, because as soon as you eat something, the body will release more insulin. There's no longer your baseline insulin, and the amount of insulin released will be proportionate to the amount of carbs in your meal, which means highly variable. In conclusion, we only test insulin in a fasting mode. There are many hormones like growth hormone, for example, that are released in what we call a pulsatile manner. To put it in layman terms, it means these hormones are released in spurts. Your growth hormone is only released during REM sleep, so you are likely to make the most of your growth hormone between the hours of 11 p.m. and 2 a.m. Clearly, testing growth hormone with a blood test is impossible. You're not going to get up in the middle of the night to go to the lab. That's not feasible. And waking up to do so will immediately impact your growth hormone release, which will shut down. Therefore, modern-day medicine uses insulin growth factor 1, or IGF-1, as an indirect assessment of your overall growth hormone release to determine whether we are looking at a deficiency of growth hormone or not. So after these few introductory examples, I hope I made it clear to you how complex hormonal testing is. But let me get to the actual subject of this mini-series of episodes, testing your sex hormones and interpreting the levels. So I'm going to start with testosterone. Why? Because testosterone is not as complicated as estrogen. First of all, it is only one hormone, testosterone, whereas estrogen involves looking and maybe testing for other types of estrogens like estradiol or estrone or other metabolites. So let me start this topic of testosterone hormone testing by asking you if you know what is the normal level for blood testosterone in a woman. And just to be very specific, this does refer to testosterone level testing in women, not in men. So according to Quest, the minimum testosterone level in a woman, regardless of her age, should be 2. So let's talk about that for a minute. We have 0 testosterone, right? There's no testosterone. Then you have a level of 1 unit above 0, and then 2. I hope you're listening to this and saying, wait a minute, how is 2 normal? That sounds like it would be too low. And yes, you are right. It is too low. However, that is the bottom normal range for testosterone level on Quest. Now, should you decide to run a Google search, asking Google, Dr. Google, what is the normal testosterone level in a woman, the top result generated by the Google AI will be an entry from WebMD stating that testosterone in a woman should be somewhere between 12 and 70 nanograms per deciliter. So let me put this testosterone level of minimum 2 that is considered normal by a lab, and I just happened to pick Quest. It could have been LabCorp or other lab. And let me put this into the following context. It is important for you to understand that a woman's testosterone level is intimately connected to not just her sexual desire, as you might have heard and already known, but also to her strength, stamina, physical, mental, and emotional endurance. It is influential, majorly so, for her mood, as testosterone has a mood stabilizing and antidepressant effect. Also, let's put this in the context of the fact that testosterone is the number 1 anabolic hormone, not just in a man's body, but also in a woman's body. No other hormone in our human body, regardless of gender, has the capacity to stimulate muscle formation, muscle repair, muscle maintenance, including bone strength, as testosterone does. And again, this is true not just for men, but also for women. And if you believe that only men have testosterone, please let go of this myth and misconception that women have estrogen only and men have testosterone only. Women have testosterone too, and it is very important for their health and their strength. All right, so if that's the case, and the testosterone is such a major player in a woman's health, your next question should be, why Quest? And again, I'm just talking about Quest as a random example. Why does Quest say that a testosterone level barely above 0 is normal? Well, don't worry, I'll give you the answer, as I have heard it from my teacher. So if testosterone is indeed such an important hormone, does it matter that your testosterone is in the lower bottom range of normal versus the top range of normal? The answer is yes, it matters, and it matters a lot for how you feel, for how strong you are, and for how well balanced your other hormones are. I remember vividly my first training for hormone therapy in the form of pellets. The doctor who trained me, Dr. Tutera, had a very successful hormone therapy practice that started in Palm Springs, I believe, and then he moved to Arizona, which is where I had my training, in 2014. He was in his 70s. I met him at an anti-aging conference, actually in 2012 or 2011, where he had a booth and he was promoting, teaching pellet therapy. Now, his business at this point mainly consisted of training other doctors. He wasn't really practicing anymore. He was in his 70s. It took me 2 years of research to decide to get trained and incorporate pellet hormone therapy in my practice. Up to that point, I had been practicing hormone therapy using FDA-approved products as well as bioidentical compounded products, but not pellets. During the training, I was told, alongside the other doctors that were there at that training, that the optimal testosterone level we were looking for when replacing testosterone in women during perimenopause and after menopause was somewhere between 50 and 200. And the optimal level was whatever made the woman feel great without any side effects. Of course, I immediately raised my hand to ask the question, which you're probably asking yourself at this point, what the heck? The lab normal range is minimum 2, maximum 45. I forgot to tell you that is the normal range, 45 for Quest, for maximum testosterone. So where does this optimal level come from? I asked Dr. Tutera, how am I going to explain to my patients about their optimal testosterone level. When they will get the result, they will look at it and they will see that their result is way above the normal range. Wouldn't that freak them out? Wouldn't they panic? And he said, yes, that's an excellent question. He went on explaining that he called the two major nationwide available lab testing facilities, Quest and LabCorp, which took him some significant time and energy because it's not easy to get to the higher-ups, and asked all the way up the ladder of command in terms of professionalism and decision-making, how did they come up with these values for their range of normal? You will never guess the answer. And now that I have a podcast, this is my megaphone, and I can't believe I'm able to actually tell you what he told me. God rest his soul, because he's no longer alive as he passed away in 2015, was that the levels were picked at random. The answer he received, though shocking, is probably the truth. Now, it makes zero sense on why a testosterone level for such an important anabolic hormone should be considered normal in a woman when it's barely above zero. And why pick 45 as the top range of normal when a large amount of young women have normal, healthy testosterone levels with no clinical signs and symptoms of disturbance or androgen testosterone excess when their levels are between 50 and 80? Well, you probably did not know that many women have healthy testosterone levels between 40 and 80, which would make many women be outside of normal range and considered suffering from androgen excess. So in order for your physician to accurately interpret the data provided by the lab regarding your testosterone levels, your physician should have received some training in testosterone therapy and testosterone management. Otherwise, your doctor would have no idea of what I'm telling you, that the so-called normal levels for testosterone are randomly picked and likely to have no correlation with optimal testosterone levels in women. And to drive my point home, we really have no idea what an optimal testosterone level is in women because no one has done research on this specific topic. Show me the research. If you find it, please email me, message me on my website. I will be glad to see it. Also, what's interesting is that this so-called normal range does not allow for any variability with age. But a woman's testosterone will be higher when she's younger and is known to decline with age and ovarian deficiency in the majority of women. There are quite a few notable exceptions, and women continue to make testosterone all the way into menopause. I have quite a few 70-year-olds with excellent testosterone levels that are 70 or 80. What is interesting about this is that the age variability reflects immediately when Quest reports estrogen levels, but it does not reflect in any of the testosterone range reported for women. So here's the million-dollar question. Well, not a million-dollar question. Let's call it the $100 question. What is the optimal testosterone level in a woman? When a woman comes in with testosterone deficiency symptoms, how much testosterone should she receive? And when she looks at her testosterone levels before and after testosterone therapy, what should she expect to see? So let me first address the question of optimal testosterone level in a woman. In an ideal world, if you're a woman in your 40s, 50s, or 60s, and you're presenting with testosterone deficiency symptoms, your doctor should strive to bring your testosterone levels to whatever your testosterone was when you were at the peak of health and hormone balance, right? Whether that was your 20s or 30s, it doesn't matter. Well, how do we know what the best optimal testosterone level was for you as an individual if you were never tested when you were at the peak of your health and you had perfectly regulated, balanced sex hormones? How do we know what that hormone balance looked like for you specifically if you were never tested? Hormone balance matters, and you cannot take one individual hormone, let's say testosterone, and look at it alone. You always want to look at the entire picture involving not just testosterone, but estrogen and progesterone, and all three of them ideally function really well together as a team. If you have high testosterone in your 20s, but very low estrogen, that's a sign of PCOS. That's not good hormone balance. Now, no one out there that I know of, outside of myself, is pushing this idea of testing hormone levels at the peak of health. Everyone, and I mean literally everyone, doctors and patients alike, think about hormone testing only when they have a problem. So the absolute majority of people getting tested for hormone levels are doing so when they already have a problem, which already puts them outside of an optimal zone, right? They're way below. So if any lab will pull their data for statistical analysis, let's say 100,000 women or 1 million women between the age of 20 and 50 or 20 and 40 to look at their testosterone levels, most likely this is how they come up with that range. But what if this range has nothing to do with optimal testosterone levels because it is already skewed by the fact that the 100,000 women or 1 million women whose data is statistically analyzed to generate the range are already outside the range. Now, I know testing your hormone levels when you feel great is a novel idea, but we, the physicians, know, and you, the patients, and the public opinion also agree that hormones are crucial for your health and optimal functioning. So why are we, the doctors, not advocating and incorporating testing hormone levels for all women and men regularly every year as part of your annual exam? Why is there such a resistance of the medical community to having sex hormone levels tested? Here's my opinion. Every man, regardless of age, should have his testosterone levels checked and kept track of. We cannot start understanding what is happening to someone's hormones, especially their sex hormones, unless we know what those hormones look like at some kind of a baseline, when that man was healthy at the top of his game. Every woman should have her testosterone levels checked as part of her annual check, and the level taken into the context of her overall health and all the other sex hormones. Again, it is much more complicated for women because on top of testosterone, you have estrogen and progesterone, you have thyroid and insulin, and all of these can impact testosterone levels, and testosterone levels will impact these other hormones as well, including cortisol. Young women are also much more likely to use a hormonal birth control pill, ring, patch, or hormonal implant that are, in all likelihood, interfering with their natural sex hormone production, blocking it. So testing sex hormones for a woman has to be taken in the context of all her natural hormonal circumstances and whether or not she's using synthetic hormones. And again, this is a novel idea to consider, but I hope one day will become standard of care. Ideally, whether it's a young woman or a mature adult woman, when they consider a synthetic birth control method that will interfere and mess up their hormones, they really should test their sex hormone levels before considering that specific hormonal treatment. Because that hormonal treatment that they're going to get, especially if it's a birth control method, will impact their sex hormones for years to come. So they want to know where they were when this all started. Many women take birth control for decades, and they live most of their life in an alternate state of reality as far as their sex hormones, which is very different than a reality of a woman who produces her own optimal hormones. I'm going to mention this in passing, but if you are a young or mature woman listening to this episode and you're using a birth control method that blocks your ovaries from producing your own sex hormones, you should know that you are in a state of chemical menopause. For all intents and purposes, you have no natural estrogen production, which equals to no natural progesterone or zero progesterone. And when your ovaries are blocked by synthetic estrogen, your body does not react by raising your FSH levels, the follicular stimulant hormone, what I also call the menopause hormone. So you do not have hot flashes, but you have no estrogen. Your body knows it. It feels the lack of estrogen, and so does your brain, your mood, your focus, your emotions, your bones, your muscles, and yes, your vaginal and sexual well-being are impacted by this no estrogen situation. But you have youth on your side, and that's to your advantage. And again, you have to look at the benefit of having the comfort of knowing that you cannot get pregnant if you do not desire pregnancy. A very important key piece of information that you should know about testing hormone levels, more specifically testosterone levels, is the fact that if you were a young woman using a birth control method that is blocking your own natural ovarian sex hormone production, then you should also know that your testosterone level is likely less than half what it would be otherwise naturally, because testosterone is produced in the human female body by the ovaries under the influence of the brain, which is also using the pituitary gland as an intermediary. And half of the testosterone is produced by the adrenals. So by being on a birth control method that blocks your ovaries, you are losing half of your testosterone. So again, I'm going to repeat this. When you take or use a birth control method that contains a synthetic hormone, which is blocking your brain and your ovaries from making your own natural hormones, it is not happening just to the estrogen and the progesterone. It's also happening to your testosterone. So women in perimenopause, beware when you're told that you should control your symptoms with a birth control pill. Let me come back to what would be the optimal testosterone level conversation. There's a huge difference between a woman's natural optimal testosterone level, which is an idealistic, lofty goal and a very big unknown, and the normal range testosterone levels provided by the lab. And again, that's because no one gets tested when they feel awesome. Again, by the way, no one goes to the doctor when they feel awesome. So the doctors and the researchers and the labs have no idea what ideal optimal testosterone levels would be for a 20 or a 30-year-old because they never get tested when they're at the peak of their health. We do know that testosterone declines with age and starts to do so in your early to late 30s. As I've pointed earlier in the podcast episode, no one, not even the patient themselves, are advocating or demanding that their testosterone levels as well as the other sex hormones are tested when they feel at their best, when they're not on any synthetic hormones, or they're not taking any major mental health medications that obviously are known to impact sex hormones. And that's the thing. No one goes to the doctor and wants to get tested when they feel good, but that needs to change. From a common sense perspective, which is the perspective I try to bring to all my podcast episodes and to my practice of medicine, both the doctor and the patient alike have no clue what is the optimal testosterone level for a specific patient that's sitting in front of the doctor at the age of 40 or 50, not feeling well, and asking about testing hormones for possible hormone therapy. Because that means going back in time when they were feeling great in their mid-20s or 30s and testing their testosterone levels. Well, we can't do that. So how do we know what levels we are to strive for if your levels were never tested when you felt your best? Well, the answer is simple. We don't really know. This is where the lack of standardization that I mentioned at the beginning of this podcast episode comes into play. Now you have to use Dr. Google, or most doctors just use Dr. Quest to interpret the results. But we know for a fact that having a testosterone level under 40 is likely not where the majority of women optimally are when they feel their best. So if we strive to increase testosterone levels in a woman, then how high should we go? Well, the answer is very simple. We should go as high as that woman needs without triggering any negative consequences or side effects or long-term risks. And that is going to be highly variable from woman to woman. So there is an art to hormone management. Now, here's the thing. There are physicians who advocate that a woman's testosterone levels during testosterone therapy could be as high as 300. I personally disagree. I think that such a sustained high testosterone level is very similar to physiologic low testosterone levels in a man. We absolutely do not know the long-term consequences of a woman's testosterone level being consistently over 300. How safe it is, or how dangerous it is, and what the impact is on her mental, emotional, and physical health. I can tell you that many women who incidentally receive a moderate to high dose of testosterone and respond with an increase in their testosterone levels to low 300s feel absolutely awesome. They have zero problems and zero side effects, and they probably feel a little bit like Wonder Woman. And I've heard it from them when I cautiously look at the test results and I'm like, oh, crap, and ask, hello, hi, how are you feeling after your hormone therapy? They almost all of them unanimously answer the same. I feel great. My mood is great. I feel so strong. I can endure stress so much better. I love sex again, and I love the way it feels and the way I feel. And they're very thankful. Obviously, there's a large variety of responses, so occasionally some women feel that is too much for them. And they say so. They tell me stuff like, I feel too hyper. I've been a little too aggressive. That's not me. I have too much angst. I think about sex too much. That's distracting me from my work. I've heard a lot of stuff. Now, I personally believe that if a woman has testosterone levels that are consistently and persistently over 250 to 300 for a long time. It could invite possible undesirable consequences and would definitely be a more increased risk than, let's say, someone who has persistent, consistent testosterone levels under 200. As far as I know, there's not enough sufficient data or research to provide an accurate answer to this question. Now, what I want to point out at the end of this podcast and leave you pondering this for yourself is that a woman's testosterone, the natural testosterone level, let's say between 50 and 80, right, is going to feel very different in a younger woman than what a testosterone level of 50 to 80 from testosterone therapy will be able to do for a woman in her 50s and 60s and beyond. So what do I mean by that? I mean that a young, healthy 20 or 30-year-old woman who has a testosterone between 60 and 80 will likely feel great and awesome. However, by providing testosterone therapy and aiming for a testosterone level between 50 and 80 in a woman that has aged by 4 decades or more will not reproduce that feeling of awesomeness. A woman's body has aged. So in the 5th decade and beyond, there will be changes to the muscles, to the bones, to the mental function. And those changes will require likely what we call supraphysiologic levels to achieve that sensation of awesomeness again. Most likely your testosterone levels will have to be above 80, possibly close to 150 or so, in order to allow muscle buildup, muscle repair, new muscle regeneration in a body that is significantly older, that has seen damage. But testosterone can do that, and can do that well. That is why testosterone is an awesome anti-aging hormone for women. So yes, a testosterone level between 100 and 200 in a woman is what we call supraphysiologic. It's not a level that exists naturally in a woman's body. It will only be possible when a woman undergoes hormone therapy with testosterone. I hope I clarified a lot of unknowns and questions you had about testosterone level testing in this episode, and some general questions you might have had about hormone testing. I sincerely hope that this information I provided today clarifies the mystery of what testosterone levels should be in a woman that is not on hormone therapy versus a woman who is getting hormone therapy with testosterone. So with all this said, please join me next week as I continue this discussion, and I will talk about when to test testosterone levels during testosterone therapy. Should we test in the morning before you put your cream on, or should we test in the afternoon after you have put your cream on? If you're receiving testosterone injections, when should you test? And if you're receiving or are interested in receiving testosterone pellet therapy, when should testosterone levels be tested? How long after the pellet? And should you be tested again right before another pellet is given? How scared should you be when your primary care doctor tests your testosterone levels and tells you that your testosterone is too high and advises you to go back to your prescribing physician and tell that doctor that manages your therapy to decrease your dose? And why is there no consensus about testosterone levels during testosterone therapy? All the answers to these questions and much more, I will see you next week. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.